If you can put it in. السلام عليكم ورحمة الله تعالى وبركاته. Good evening, good morning, everyone from all over the world for joining us in the Shatkin 2023. This is the second session on the last day or the final day of Shatkin 2023. This session is titled, this session will handle the health professional education resilience. I'm glad and honored to introduce a friend of mine and a colleague, Dr. Taha Masri. Dr. Taha Masri is the director of disaster medicine in King Abdulaziz University Hospital. He's a distinguished physician and a leader in disaster medicine. Currently serves as a director of disaster medicine section in the University Hospital of King Abdulaziz University, Jeddah, Saudi Arabia. He has carved a niche in the field of disaster preparedness and emergency management. He also, his academic journey is marked by notable achievements, including a fellowship in disaster and emergency management from Harvard Medical School, and a master's degree in healthcare emergency from Boston University School of Medicine, USA. And yes, these prestigious qualifications underpin his profound understanding of the complexities and challenges inherent in disaster fields such as mass casualty management, disaster plan implementation, hazardous materials response and handling. He's also have several contributions in the research in disaster field and several publications indeed. So I think talking about Dr. Taha Masri will last for a very long time, but that's some of all in his resume, and we are very eager and honored to hear from you. Very interesting topic about the context of disaster medicine to support health profession education continuity. Dr. Taha, the floor and the microphone is yours.
I would like to thank you, Dr. Hisham, for this introduction, and I would like to thank the Sudanese Health Professions Education Conference Organizing Committee and Scientific Committee for this invitation to give this talk, though. Thank you again for all of my colleagues that have presented before, and for all the audience for their patience and for the keen in the way that they actually preserve and excellence in the profession of education. And especially in the context of resilience, I'll try my best to give you a small talk about how we can integrate the disaster medicine into the health profession, and how we can build our resilient future medical education, inshallah. I don't know, can you see my slides now? Is it proceeding?
Yes, it is.
Right. So as a hint at the beginning, I'm just going to go through what I'm going to give you as a talk today. I'm going to start with an brief introduction about disaster medicine. Then I will go over the importance of integrating the disaster medicine in health education, and then we'll understand the gap that actually we are facing in the medical education, especially in the disaster medicine, and what is the importance of it, and then what is the barriers to integrate this disaster medicine in our health professional education. Then I'll go through the interprofessional education part in the disaster medicine, then how the student advocacy and policy can impact that, and how we can build our holistic curriculum, then implementing the change that we can face over that. Although we're going to go throughout a global perspective and see how can this, in the context of building the curriculum, can help make us resilient. And then we're going to go throughout the future of disaster medicine education and what is the global vision. And we'll give you some examples about what's happening here in Saudi Arabia and how we can improve our quality education and consistency in training throughout that. And with that, let's start. So as an introduction, I'm just going to throw out about the disaster medicine. What is it? And it's the field of medicine, of medical care and planning to address the healthcare needs in the large scale emergencies or disasters. It's actually encompasses a range of medical and health services required in disasters, including triage, medical treatment, psychological support, EMS part, and others. Although the key components for any disasters is, as you can see, it's the disaster life cycle. It starts with prevention first, then mitigation, supposed to be here, and then preparedness, and then response and recovery. And I'm going to say some of the challenges that we may face over this disaster life cycle. So for prevention, the best way to address a disaster is by being proactive. This means identifying potential hazards and diversing safeguards to mitigate their impact. As for mitigation, it aims to minimize the loss of humans' life that would result from a disaster. Both structural and non-structural measures may be taken, though. And preparedness part is an ongoing process within an individual, communities, businesses, or both structure or organizations can be planned and trained for what they will do in the event of a disaster. Preparedness is identified by ongoing training, evaluating, and corrective action plans, ensuring the highest level of readiness. Although in the response part, which comes after the incident or the disaster itself, the response is what happened after the disaster occurs. It involves both short-term and long-term responses. Ideally, the disaster management leaders will coordinate to use the resources that they have to help restore personal and environmental safety, as well as to minimize the risk of any additional property damage or human losses. During the response stages, any ongoing hazards should be removed, and the area should be safe, though. In the recovery part, which is the fifth stages of the disaster medicine and management cycle, is the recovery. This can take a long time, sometimes years, sometimes decades. For example, some area like an example in New Orleans, and what happened with Hurricane Katrina, and how they, in 2005 until today, they are still recovering from that. Some challenges that may face, it's always the limited resources, the high patient volumes, the psychological impact for the victims and the responders. Also, the impact that can affect the population and their medical health systems, and how they can actually recover from that. Next slides. It's the importance of integrating disaster medicine in the healthcare education. It goes in three pillars: rising the incidence of disasters, it's increasing the frequencies and severity of natural and man-made disaster worldwide, necessitate that the preparedness. Although the knowledge and skill gaps in the healthcare professional often lack scientific training in disaster response, that highlighting the needs for integrating disaster medicine education, though. Global health impact effective disaster response can significantly reduce mortality and morbidity associated with any disasters, though. To understand the gap, in the United States, the Council of Disaster Medicine Fellowship Director developed the 2023 model core content for disaster medicine. This curriculum is recommended for physicians training in formula, the United States Disaster Medicine Fellowship programs, addressing the needs for the centralized disaster medicine education. Despite this, disaster medicine is not recognized as a subspecialty by the American Board of Medical Specialties, leading to variability in disaster-related knowledge and skills among physicians trained by the ACMG's accredited programs, though. Comparison to the emergency medicine residency and the EMS fellowships, there was a study in the United States found significant disparities in the coverage of the disaster medicine curriculum components between emergency medicine residency and emergency medical services fellowships. The EMS fellowships covered around 79% of major curriculum components and 38 of subtopics in disaster medicine, while the EM residency covered only 37% of major components and 16% of subtopics. This indicates the lack of standardization and depth in how disaster medicine topics are addressed in either curriculums, though. This is a study done by us in Saudi Arabia, me and my colleague, Dr. Olaya Serimani, and some of our students. In this study, the level of knowledge regarding the disaster management average among the healthcare population, and especially medical students in Mecca city, it was a cross-sectional study, and there was a certain aspect of disaster medicine are needed to be focused on such first aid skills and triage and evacuation, incorporating disaster medicine as a part of the training program as it's in demand, though. There is another study, although it's old, but it shows the difference between the healthcare professional and medical students and community residents, and it was talking about the key contents concerning disaster medicine training prioritized by the health professional and medical students and community residents. The key contents concern the disaster medicine training prioritizing by health professionals. It was as giving as below. As we can see here, I don't know if you can see the marks. It varies between the first aid skills up and epidemiological prevention and control, psychological problem in post-disaster relief, disaster supervision, basic concept in disaster medicine. Although there was a big gap and variation between the residents and the students and health professionals in each part of aspects. As you can see, the most practice that you go as a health professional, especially in the EMS part or in the nursing, lots of impact. They had a huge knowledge, while medical students excel in the first aid skills. The community resident, they actually scored at a high 60%. Though. So why it's important? We have faced COVID-19, right? We are facing conflicts, wars, and like in Sudan, like in Palestine, like inshallah. The COVID-19 pandemic has been a defining global health crisis, demonstrating actually the critical need for operational readiness and coordinating response to infectious disease like pandemics, has emphasized the requirement for the nation to have tailored preparedness plans and improvement collaborations across various sectors. We have seen that with the WHO messages, with CDC messages, and how we can control that. Although most of the countries have struggled. Climate change also significantly impacting the public health, affecting everything from human physiology and mental health to medical logistics and response capabilities. We can see floods like what happened in Libya and what we are actually facing in our Arab world now. Public health emergencies, including pandemics, natural disasters, man-made disasters, and the impact of the supply chain, the interpretation and the health services delivery challenges, they also have indirect effect, such as damages to the infrastructure and community systems. The complexity of disaster and emergency medicine emphasize the need for the multidisciplinary and multi-sectorial collaboration, particularly highlighted by the COVID-19 pandemic as we have faced it before. This collaboration is essential for overcoming the challenges and preparing for the future disaster. There is barriers that we faced, and it have been shown by Walexer et al. In his publication 2023. There was 4 pillars for that. It was institutional challenges. There is a need for the standardized curriculum supporting the training of disaster medicine to the practitioners. The global leadership in disaster medicine education is essential, as seen in the WHO guidelines on integrating emergency preparedness into the undergrad nursing curricula. There is a logistic challenge. The logistic challenges, including the integrating disaster medicine into existing medical curricula and ensuring that the content is relevant and up to date. This requires continuous review and updating to address the evolving field of disaster medicine. Although there is an educational challenges, the student representative organizations such as the International Federation for Medical Students have called for the incorporation of disaster medicine into medical curricula. This highlights the gap between the current educational offering and the student demands. Resource-related challenges also, there was a limitation in resources and expertise, especially in developing effective and comprehensive educational programs in disaster medicine. The diverse and the dynamic nature of disaster scenario makes it a challenge to develop a one-size-fit-for-all curriculums. The interprofessional education in disaster medicine, it's important to collaborative learning in disaster preparedness. The importance in the interprofessional education in disaster medicine curricula for enhancing the disaster preparedness. It fosters a teamwork mentality among the healthcare professionals, and essential for effective disaster response. The IPE in disaster medicine integrates various healthcare disciplines, enhancing communication, coordination, and collaboration skills. This integrated approach ensures the healthcare professionals are better equipped to respond collectively and efficiently in disaster situations by bringing together individuals from different healthcare disciplines. The IPEs foster an environment where shared decision-making and problem-solving become a norm. The global threats in interprofessional disaster education are likely to influence the educational approach in the region. Although student advocacy and policy impact, as much as we have seen the needs from the students as they have faced, like in Sudan or in COVID-19, or what we are actually really seeing in Palestine, the evolving field of disaster medicine is an adapting to the change of the global scenarios, such as increasing the frequency of the climate-related disasters and pandemics. The field is now recognized the needs to incorporate various specialties, including critical care, primary care, into the disaster medicine training. Medical student advocacy and policy impact in disaster medicine significantly influence policies, reform, and the healthcare practices. Their active participation in organizations like the American Medical Association leads to meaningful changes in medical education and disaster medicine policies. Advancement in the disaster medicine education with the remote technology, it was for the development of a new remote technologies such as an immersive virtual reality or revolutionizing the disaster medicine education. These technologies enable medical students and healthcare professionals to engage in cooperative activities such as triaging or group working, or even excel with their communication part, or even though in the social interaction between them, which are essential for effective disaster response training though. Successful advocacy initiatives in disaster medicine, it was a prominent example of successful advocacy in disaster medicine can be seen in the role of medical students in influencing the AMA policy changes. Their activities, participation in medical groups and councils has led to significant reforms of medical education and healthcare delivery, showcasing the tangible impact in the students-led advocacy initiatives have actually influenced us, like how we can build a holistic curriculum later on. And that's our components for building such a holistic curriculum. Start by technical skills, leadership, communication, and some ethical consideration that we are also facing in disaster medicine. For the technical skills, the curriculum should include a comprehensive understanding of emergency medicine, pre-hospital medicine, public health crisis response, and critical care, and primary care. For the leadership, training is essential in disaster medicine. This involves the planning, the implementation, and assessing the patient management in various situations and locations where medical care is required, especially in resources, if your resources is constrained. For example, the 2023 model core content of disaster medicine developed with the support of the American College of Emergency Physicians, the ACEP, incorporate these elements. Communication, this includes the communication skills and the ability to coordinate with the different stakeholders during the disasters. Although an ethical consideration, disaster medicine often involves making difficult decisions under pressure, such as allocating scarce resources and training in ethics, and therefore an integral part of the curriculum. preparing practitioners to make informed decisions in a crisis situation. As we have learned and seen throughout, starting from Katrina and how Dr. and Paul have made that critical decisions in evacuating Memorial Hospital. If you did not see it, please go ahead. It's a book called 5 Days at Memorial Hospital. It's really challenging and a good book talking about ethical considerations and how they have handled it during Katrina, though. To implement these changes, we have to go through curriculum development, faculty training, and resource allocation to get the successful implementation model and actually see what successful implementation models in different countries and how we can implement it to your country. For the curriculum development, integrate the public health and disaster management system. You have to assess the community diseases burden and mental health care needs, evaluate and revise funds for resilience in disaster management. Utilize and standardized curriculum like the 2023 model core content of the disaster medicine. For the faculty training, you have to focus on unique clinical situation in disasters. You have to include the technical and administrative and ethical expertise. Ensure the faculty proficiency in emergency medicine and public health crisis response and the critical care too. For resource allocation, critical and disaster medicine education, especially in developing regions. Embedded long-term recovery groups in emergency medicine system. Provide the non-medical services to support the broader communities. You have to be efficient use of your resources based on a deep understanding of the local context and the population needs. You have to emphasize and adapt and use a focused public health system. You have to serve community needs while sustaining a vital function during disasters. You have to utilize tools like the WHO Health Emergencies and Disaster Risk Management Framework. You have to consider the tools such as the United Nations Disaster Risk Reduction, the Public Health System Resilience Scored for the baseline resiliencies and prioritizing their actions.
Sorry to interrupt, Dr. Taha. We have 5 minutes to wrap up.
I'm trying to wrap it up right now. So this is a study by Breslin et al. It was exploring the Irish faculty member and how they built their expertise and experience of developing a multimodal medical educational course in a resource-limited environment. And there was a survey demonstrate the significant impact of the teaching, such as a course, on the faculty members. Despite the challenges encountered, faculty members strongly felt that the simulation training offered with a significant benefits to them, though. For the global perspective and leadership, there is a booklet titled Sendai Framework for Disaster Risk Reduction from 2015 to 2030. It contains an important global targets for disaster medicine as follow. It's also to investigating in the disaster reduction and for better resilient communities. Significantly reduce the global disaster mortality by 2030 to reduce the global mortality rate by 100,000, although significantly reduce the number of people affected by the disaster globally. It also looks for preventing the damage of the critical infrastructure, including the health and educational facilities. In the WHO, they created a thematic platform to work on a cooperation and coordination with both the health sectors and the other relevant sectors, which supports the implementation and the guidance of the Sendai framework, the sustainable development of goal objectives and Paris agreements the international health regulation, and other WHO regional and global solutions that they are actually offer. The main objective there was for the health emergency and disaster risk management framework, guided by published in 2019 by the 15th WHO book, which determines the 5-year strategic direction of the WHO for the 2019 till the 2023 period. It was to emphasize the importance of prevention and the preparedness and the resilience, together with the intervention of the improvement efforts to protect the health and to save lives. This is the global education cluster works towards a predictable, equitable, and well-coordinated response addressing the educational concerns of crisis affecting population by reinforcing the capacities of cluster staff and patterns, providing timely, remote, and direct field support, strengthening robust assessment, analysis, and advocacy in the educational part. And that comes from the UN humanitarian and emergency relief clusters. Members of the Council of the Disaster Medicine Fellowship Directors have developed the 2023 model core content for disaster medicine in the United States. This living document defines the foundational curriculum for the Disaster Medicine Fellowship, providing the basis of the standardized experiences that they had, contributing to the development of a broad certified subspecialty and informing fellowship directors and the disaster medicine practitioners of the content and topics that may appear in the future certification and examination. Future doctors and nurses are needed for more training in the disaster medicine. The vision for a global and a cohesive approach in medical education resiliency throughout a cohesive approach in the global direction and the consultancy experience. For the global direction, Dr. Efland et al. In 2022 and Smith et al. In 2022 highlighted that the collaboration among international medical institutions foster or more resilient education systems. It allow for sharing of the best practices and resources, leading to more robust training programs. Consultancy experiences involving experienced consultants can enhance the resilience of medical education. Consultants bring a wealth of knowledge and helping institutions navigate challenges and implement effective strategies, as we actually have that example here in Saudi Arabia. This is a part of our educational journey, along with Dr. Hisham Dinar, as we can see in the Saudi Disaster Medical Assessment team, DMAT team. The images and the slides illustrate the critical context in which the disaster medicine education become vital. The Deptec virus, various scenarios, as you can see in the Saudi disaster medical assessment teams in action with the healthcare professional training for any crisis situations or the aftermath of any disaster events. Each of these photos underscore the robust disaster medicine curricula to prepare the healthcare professional for real-life emergencies. You can see from didactics to simulation-based and to tabletop exercise up to full functional exercise that we have gone through. And this was, as you can see, the left lower photo, it was part of the, I was one of the teams that have actually worked with previous Hajjs as a part of the consultant based in disaster medicine assessment team in Saudi Arabia. Although our experience have been published before in disaster medicine curricula building with Dr. Nidaba Joan et al. And the conclusion was the response rate was from all of the universities in Saudi Arabia was 67%. Only 3 of the responding 20 universities currently have disaster medicine programs, and they spend an average of 3 hours per year on the subject. Responders without disaster medicine curricula, the rest of the 20s, indicated that the mandatory and accredited courses in the final 3 years of the 6 years program was their preferred method to implementation and the most favored a blended approach. There is another study was done in Saudi Arabia with Dr. Nidaba Jo and her team. It was talking about the disaster health education framework for a short and intermediate training in Saudi Arabia. It was a scoping review, and that was concluded, as I call it, the review highlights the objective scarcity of short and intermediate terms evidence-based disaster health program in Saudi Arabia. Adoption of the educational frameworks proposed by the authors based in the international frameworks could improve the quality and consistency of the disaster education curriculum in Saudi Arabia. And that comes us to the need for the quality education and consistency in the training. That the healthcare professionals are not only proficient, but also resilient in facing future challenges. It's worth noting that effectiveness training can prevent or reduce the effectiveness of some disaster. Regular training sessions play a crucial role in keeping healthcare workers abreast of the latest advancement in medical technology and practices. This continuous learning approach not only enhances their skills, but also prepares them to respond adapting to emerging health crises. This is a study by Dr. Louis et al. In 2023 that was conducted across several hospitals in the United States, found that the nurses who participate in the regular training sessions, particularly in the area of crisis management and the latest medical technologies, demonstrate a greater adaptability and efficiency in emergency situations. And in conclusion, to build a resilient future in medical education, we need to recognize the significance of disaster medicine integration in the health professional educational curricula, to identify the existing gap in understanding, emphasizes the needs of the comprehensive disaster medicine training, the importance of the disasters medicine and underscores its role in equipping healthcare professionals with essential skills for crisis management. There is barriers to integration, and to this integration, as outlined by Wellexer et al. In 2023, the highlights a challenge that must be addressed by effective implementation, as we mentioned it. For the interprofessional education, student advocacy and policy impact are the key avenues for driving changes and ensuring a holistic approach to disaster medicine in healthcare professional education. And with that, I would like to conclude my talk though. Thank you a lot, Dr. Hisham, and thank you for this time. And I'm sorry I was a little bit over my time though.
Thank you very much, Dr. Taha, and you probably triggered a lot of questions, but probably I'll hold it to the end of the session. Dr. Taha, for those doesn't know, is a very active member in the Saudi Disaster Medical Assistant team. And I don't want to spoil things, but I think one of the recommendations of this conference is to work on the development of SUDMAT, Sudan Medical Disaster Medical Assistant team, and we'll be honored to be one of the advisors for this project, Dr. Taha. Thank you very much indeed.
It's my pleasure and my honor to work with you, Dr. Hisham. I just want to add, this is my references throughout the talk. Feel free to reach out to me if you want throughout this barcode, and I will get back to you if you need any information, more information about the talk, though. Thank you all for your listening, though.
Brilliant. Thank you very much.
Thanks.
Now, we'll be moving to our next speaker, Dr. Sharon Raymond. Dr. Sharon Raymond, experienced general practitioner and finalist of the 2020 Daily Express Amplifying Coronavirus Hero of the Year Award and GP of the Year, as well as the winner of the Inspirational Woman 2020 and Woman of the Year 2021. Most recently, finalist in the HSG J Care in the Community Award 2023 for the CRF Vaxi Taxi Health and Wellbeing Pop-ups. She's a highly experienced and scheduled urgent care triple one GP with extensive clinical leadership experience. Dr. Raymond named GP for safeguarding children for areas in the 2 London ICBs, mental health lead for 1 area in London ICB, and more yet to come. Dr. Raymond have a very long CV, very wealthy CV, but most of all, and the most important, she is the establisher of Crisis Rescue Foundation, UK, and she will talk and add more to this discussion, presenting and talking about uniting hope for learning. Dr. Raymond, welcome, and the microphone and the floor is yours.
Thank you very much. I hope you can hear me okay. Is the sound all right?
The sound is okay. Thank you.
Okay. Thank you very much for my introduction, and it's a pleasure and an honor to be here with you all today. So I'm going to be talking about uniting for learning and global endeavors in preserving medical education continuity. A lot of things have been happening globally as unfortunately we've seen wars unfold and the impact on medical students and also on doctors of accessing medical education. I'm just going to ask you to just take one step back to the first slide. I'm sorry, apologies. And we've seen some of the challenges in accessing medical education and also peer support. And what we did as the Crisis Rescue Foundation, we're a non-profit foundation established in 2020, in spring of 2020, of which I'm a director. And particularly when the Ukraine war kicked off, many people were approaching me, both students and doctors from the region, saying that they were struggling to access medical education, that their medical studies were being put on hold because of being in a state of war. And also doctors were struggling to get access to medical education, and peer support for all medics was very thin on the ground. So we have a team that's developed to around 250 mainly UK lecturers, although we're delighted and honoured to have lecturers from other parts of the world, including from Sudan, who contribute to our lecture program. So if we look at the next slide, please, you'll see a summary of some of our work to date. We are the Crisis Rescue Foundation Medical School UK elective program. And, you know, I'm focusing on our experiences, although, of course, there have been many other initiatives to support and provide education for medics affected by war. However, my understanding is that we're the only global free medical school elective program of its kind. And we're virtual, we're on Zoom, and we're accessible not just for medical students, but also for qualified doctors. And we are providing medical school type lectures that would suit particularly final year or students in their final years. We also cover war zone medicine, peer support, well-being sessions. So we have a strong team of psychologists and psychiatrists delivering well-being sessions to give people some of the tools to deal with the trauma that they've experienced or may be experiencing. And we've been collaborating with overseas and UK medical schools lecturers to structure the program, and our lecturers are recognised by overseas medical schools for undergraduate medical studies. And I'll talk a bit more about our collaboration with a prominent and well-known Sudanese medical school. And really the goal has been to take the pressure off medical schools and lecturers in war-torn and crisis-hit countries by delivering online and on-demand lectures. So we have a platform whereby people who, because they've got perhaps difficulties with internet or the timing is not right for them, then they can access our lectures also on demand. And we have a suite of hundreds of lectures given by experts in their fields. And bearing in mind that people may be in their own countries, or they may be displaced globally as a result of war. As well as the lectures, the well-being sessions, the peer support, war zone medicine, we have also managed to support 60 clinical placements in the UK. And these have been mainly in GP surgery settings. So when doctors and medical students reach the UK, I've been able to collaborate and connect with colleagues who've been able to help people to have clinical placements, which have been useful, particularly where medics feel that they're disconnected from their studies and from the practical side of medicine. So that can be a very positive experience to be doing some clinical placements, as I'm sure you all understand. So far, just some of the feedback and statistics. So far, we've had over 22,000 overwhelmingly positive feedback responses, with nearly 100% of respondents confirming that their topic knowledge was improved by the lectures that they participated and joined in. We've had over 2,000 trainee and qualified doctors located globally who've registered and joined the program. And since April 2022, we've organised hundreds of online lectures, as I said before, and we've got a team of over 250 experienced medical lecturers, most of whom, as I said, are in the UK, but some are located globally, and we do collaborate with them regarding content, so it's appropriate for our students. According to a Crisis Rescue Foundation survey, nearly 90% of medical students would return to the Ukraine when we did a study regarding Ukrainian students to study after the war, thanks to the Crisis Rescue Foundation Medical School. And we do very much have a focus on addressing the issue of brain drain. So in times of war, as I'm sure you're all aware, where people are being displaced, leaving their countries, going elsewhere in the world, while we want to absolutely support them with their studies, that's with a view to, when war is over, when peace is restored, that they're able to go back to their countries, complete their education and contribute to the medical systems in their own countries, as was presumably the original plan. 98% of our lectures have been rated as excellent and good by attendees, which is very positive. And on this slide, you can see some of the organisations that have recognised our work and collaborated with us. So the Royal College of General Practitioners has highlighted our work, and we've been supported by the UK Medical Schools Council, the British Medical Association, the General Medical Council, the Ukrainian Medical Association of the United Kingdom, the Ukrainian Medical Students Association, Bogomolets National Medical University, the National Brain Appeal, Small Acorns Fund, the British Orthopaedic Association, and the Sudan UK Doctors Group, and also the Al Zaira Al Azhari Faculty of Medicine, and the Medical Defence Union as well. Next slide, please. So this slide, I'm afraid the countries may not be totally clear to you, but as you can see that we have had a very wide global reach These are just the statistics for 2022. And we are, ever spreading further in terms of our reach, and students and doctors, medical students and doctors accessing our lectures and our support. Yes, I just thought that would kind of really highlight the extent of the reach of the program. And also how important, we can see that it's been very important for students in particular to maintain that contact with their studies in times of great upheaval and trauma. And that's reflected in a lot of the personal comments that reach us at the foundation, where people, express their thanks. And we always listen also to any feedback where we need to make changes or add in different elements to the study program, to the syllabus, so that it's relevant, pertinent to those who are studying. As you can imagine, it's difficult for us to be relevant and covering the syllabuses as all those, all the different countries and all the different medical schools. But we have had a particular focus, particularly in the last term that finished recently in term 5. There has been a particular focus on the needs of medical students at AAU in the Faculty of Medicine of Sudan. So we've had a particular focus on those final year medical students to try and support the medical school in helping them to achieve their graduation as doctors. Next slide, please. So a bit more of a focus on AAU medical students. As you may be aware, they were just months away from graduation when the war started in Sudan on the 15th of April 2023. And in the summer of 2023, the Crisis Rescue Foundation Medical School UK elective programme announced it would be supporting final year medical students of the AAU Faculty of Medicine of Sudan with online lectures. And we were very much guided by leaders from the medical school and academics in order to formulate the priority needs and topics to be covered by those students. And that's what we've been delivering throughout term 5, a particular focus on the need of students from Sudan. And as I say, the feedback has been really excellent and positive. Yeah, and it's quite moving actually to see some of the personal messages, particularly that I'm receiving, where people do appreciate having this ongoing connection with their studies and being supported in getting through their studies, because for many that's their dream, to achieve graduation, to become doctors, and really we want to do whatever we can to help them to realize that dream. Next slide, please. So I'm just sharing a recent face-to-face event that took place at the British Medical Association House in London a couple of Sundays ago. We had a Crisis Rescue Foundation symposium looking at some of the learning from what we've achieved so far, some of the challenges, actions for the future, and really listening to the voices of medical students, of doctors from all over the world, who've experienced the trauma of war and have had challenges in accessing medical education, completing their studies, and some of whom have been trying to work in the UK and having to jump through the particular hurdles here in terms of proficiency in English exams, and also registration with the General Medical Council, including examinations such as the PLAB examination, which some of you may be familiar with. The symposium, as I said, was 2 Sundays ago in London. We had quite a very strong representation from Sudanese medical students and doctors. We had the British Medical Association supporting, the General Medical Council came to speak as well. The Medical Defence Union also supported. We had the head of the advisory service from the Medical Defence Union speaking as well. And this was also an important opportunity to think about, how to support students and doctors, international students and doctors further. What's various actions that we should take on. Some priorities around supporting with more clinical placements and work experience. So all attendees fed back that the event was good and excellent. The majority, I believe nearly 90%, rated the event as excellent. We had some dear colleagues there, including Dr. Sarah Abdul Galil, who's been absolutely devoted to the Crisis Rescue Foundation Medical School UK elective program, has delivered multiple lectures, all of an extremely high standard, and the feedback has always been excellent, as well as her input, and along with colleagues, the various professors and doctors from Sudan, who we've really benefited so much from having your input and your kind of appraisal of what we're offering to make sure that it hits all the right notes and that we're really supporting people as much as we can be. Next slide, please. So here are some photos from that day's event, and we've got people here, colleagues here who've come from Iraq, Afghanistan, Ukraine, some UK doctors, Sudanese colleagues as well. And actually, the head of equality at the British Medical Association, Dr. Latifa Patel, gave the keynote address at the beginning. And I think just as the educational element online is really important, it's very accessible for everyone, it's also important to have that face-to-face element. It recharges people's batteries. It gives you a chance to chat. We had some food. We had some goodies brought in by the General Medical Council, by ourselves, the Foundation, and the Medical Defence Union. And it was just nice to be in a physical room together, seeing colleagues, really hearing firsthand, face-to-face, the different challenges, and exploring together ways that we can help. We did have people join online as well, which was really important as well, because, we appreciate that we are separated by distances, but because of the wonders of modern technology, and one of the very special and unique elements of the med school is that we can do so much online, and that's certainly very valued. Next slide, please. So what are the next steps for our Crisis Rescue Foundation Medical School UK elective programme? As director, my plan and the plan of our foundation is to continue to support medical students, doctors affected by war, affected by local crisis, wherever they may be in the world. We are an apolitical group. We don't talk about politics. This is really just a humanitarian effort to help our colleagues to try and achieve their goal of high standards of medical education, and eventually, practicing as doctors, and for those who are already doctors, giving them the support that they need in terms of education, and for all medics globally, to show that we are doing what we can by providing peer support as well, well-being sessions, and also frontline medicine has also proved to be very relevant, how to manage emergencies on the front line and other medical issues. We still continue to work on arranging clinical placement. So the online support continues, but as I've referred to before, trying to arrange as many clinical placements as possible. We are seeking funding for next term, term 6, because we currently do not have funding, which is a struggle. And I've put a link there for our GoFundMe page if anyone is able to donate. We are really, keen to continue to next term. We're currently on break, but after the break, we would like to resume. And I hope that some of you will be able to support us, although I appreciate that these are very difficult times, and it's whatever people can do, we value. And the next face-to-face training day for those who have a goal of working in the UK. We have a training day in the PLAB 2 examination, which is the exam that you need to pass if you want to work in the UK and be registered with the GMC, and that's going to be in an OSCE format. We ran one like that last year, in March of last year, and it was extremely successful. So if you are in London, even if you're not planning to take the exam, it's a really positive experience. We've got lots of different stations with case studies, and we discuss. We have teams of lecturers, expert medical educators who will facilitate reflection on those cases, how you would manage them, how you would manage in an exam situation. And if you would like to book, if you can be in London on that date, we'd love you to come. And there's the Eventbrite link for you to book if you're able to make it. So that's really a bit of a story to date about, or a summary to date of what we've managed to do. There's still lots more to do, and we hope that we can grow and manage to achieve the things that need to be achieved to support our colleagues across the world. And we really thank you for the opportunity to be able to help in this way. And I very much value the collaboration and the connections, with colleagues, Sudanese colleagues, and medics, medical students. It's really an honor to be able to help in some way. And I hope that we will be able to continue to help. So thank you very much for giving us the opportunity to do what we can from the UK. Thank you.
Thank you very much. Thank you very much, Dr. Sharon. Very, very inspiring presentation, and we really appreciate what you did and what you're doing actually. And I'm quite sure that what you present inspired a lot of the audience to do more when it comes to crisis. And there's always hope when there is challenges. Probably Professor Abdul Munaim Sahel, I can see that your microphone is on. If you would like to say few remarks.
Thank you, Sham. Thank you. First of all, I would like to, of course, thank very much Dr. Taha Al-Masri and Dr. Sharon Raymond for their presentations and sharing with us their experiences, which, as Hisham said, are very inspiring, and they shed the light on what we could do. Although Dr. Sharon Raymond, I think your experience is one of a kind. I don't think there is another similar experience anywhere in the world. So we will reach out to you whenever we think about anything related to this issue. Don't think there is another similar experience. It's very inspiring. Just one question. You mentioned that you are supporting medical students which are globally distributed here, there, and everywhere. How did you manage to select what exactly to deliver that is suitable to most of them? Thank you.
Thank you very much. Thank you for your kind words, Professor. I think I may have made some reference to that it obviously is challenging because it's global reach. It will be students from lots of different medical schools. And although we had spent quite a long time looking at syllabuses and trying to make it as relevant as possible, and we certainly have tried to do that first with Ukraine and now more of a focus on Sudan, what we also try and do is balance that out with reference to medical school syllabuses here in the UK, so that it's kind of relevant, hopefully, to as many people as possible. So we're trying to pick out those core topics that are likely to come up again and again in medical school studies. However, we do have some terms, as we've had now, where there's a particular focus on achieving, the goals, the educational goals of a specific medical school, such as AAU in this case. So it is challenging, and we had ideas about creating our own syllabus, but I think what we have to see ourselves is as serving those global medics who need our help. So it's got to be relevant and appropriate to them, and we have very active groups, WhatsApp groups in particular, but we can also be contacted by email, where we do listen to what students have to say, and also in the feedback we collect feedback after each lecture to see what do people want more of, less of, where are their gaps, and then I will try and locate a lecturer who's able to fill those gaps if I'm seeing that that's a theme. So it's very flexible. We've got a great deal of flexibility. We're not rigid, and whilst we are mainly referring to what would be expected in the UK, we're very mindful of different countries and the needs in those countries in terms of medical studies.
Thank you. And if you allow me, just a follow-up question. I'm following the school's activities, and being an anatomist, I was wondering why the focus is still on clerkship, training on the clerkship, for the clerkship phase, and nothing related to the pre-clerkship modules or syllabi.
So thank you for asking that. So it's been quite hard, to satisfy all years of study. So we were trying to do some sciences, we were trying to do anatomy and so on, but it's been quite challenging to satisfy everyone. Now, kind of case discussion and more kind of clinical aspects have seemed to be appropriate for most, if not all, students. But where there are specific gaps, if you or your colleagues or the students are identifying gaps that many attendees are noticing, then what I will do is take that away and see if we can organize some lectures on those particular areas. But having said that, just to explain, the majority of the lectures are quite clinically focused. They're case-based, because that seems to be relevant, throughout the years, and particularly for those later years students, the higher years, where they're very keen at that point, to really see it through and get through their studies. But as I say, we are flexible. If you have ideas, if you think we need to have more of something, less of something, we want to listen to what people have to say, and particularly your good self. So, this is something that we could take maybe offline and discuss in more detail and see, can we add in some additional lectures? I hope that answers your question.
Yes, it does. Thank you.
But I should just say, we have multiple student and doctor groups of several hundreds, if not in four-figure numbers of students and participants and doctors who give very regular feedback, private messages very frequently. It's really like it's a full-time job. So making sure that everyone is happy, and that's what we want to achieve, because after all, people have been through a lot of suffering, and we're very conscious of that. So our aim is to be respectful, is to listen to people's voices, and it is to try and provide what we can within reason that will satisfy their educational needs and their support, peer support needs as well.
Thank you very much once again, Dr. Raymond. Thank you very much, Professor Sahel. To build on what you just mentioned, we always teach our students in the emergency medicine and disaster medicine program that the difference between emergency medicine and disaster medicine, that in the emergency medicine you need to do the best for everyone comes in the ER. However, when it comes to disaster medicine, we should do the best for the most. And here comes the importance of priorities. And that's actually what CRF has been doing during crisis, focusing on the highest priorities and evolving over time. And that's really inspiring. Thank you very much. Probably I'll take one question because we are running out of time. Dr. Taha, thank you very much once again for the presentation. I have a question from the participants around I'm quoting here that to what level do you think that WHO succeeded in implementing policies and helping support disaster medicine through the map? So if you can give us some insights around that, that would be great. Thank you.
Thank you, Dr. Hisham. Thank you, Dr. Raymond, for your wonderful talk. Actually, the effectiveness of the World Health Organization in implementing policies and supporting disaster medicine, it can vary based on a multiple factors, though, including the political, logistical, and financial aspects. While the WHO has indeed provided frameworks and assistance in disaster medicine, its successes can sometimes be hindered by the complex nature of international politics. The varying capacities of the member states to implement the guidelines and availability of resources in some regions, WHO's efforts, I believe, may be highly effective, while in other political challenges and resources limitation can impede the application of policies and support mechanisms, though. It's the overall success and often a blended of the WHO initiatives and the cooperative action of member states, the NGOs, and other stakeholders in the global health landscape, let's say that. WHO, it's politics. I will say that it's the instrumental of shaping global health policies, including those related to disaster medicine. Their success in the arena of multi-faced and it is multifaceted, impacted by collaboration with the member states, the political will of those countries, and the resources available again for implementing and response, while the WHO provide the guidance and support. The practical application of their policies in disaster situation often depends on the national and the local government corporation, though. Healthcare infrastructure and the preparedness level of this local governments, which can vary widely across different regions. Political factors can indeed influence the effectiveness of policies and implementation, as governments must prioritize the WHO recommendation among their various public health. Does that answer the question, though?
Thank you very much, Dr. Tai, for being very political in your answer as well. So
I'm trying my best. The government, whenever some countries they actually take their considerations, but they don't implement it the right way, because it varies though with the communities itself though.
Absolutely.
Although building this, imagine implementing let's talk in the context of resilient medical education and disaster medicine, implementing this curriculums and medical students level throughout the healthcare professionals and physicians, nursing, paramedics, EMS ward, and how that can affect their response during any disaster that may happen in the future, and how they become more resilient with each time they face this application. So why not to use this actually already available policies that have been gathered from different countries, and different disaster scenarios happened all over the world, and then actually start from the point where the others have actually end.
May I, Dr. Hisham, because he touched on an area in which I'm interested as a medical educator. I know, by the way, I was in Saudi Arabia for quite some time. I had a very strong relationship with the Minister of Health in Saudi Arabia, the Saudi Minister of Health, especially this group of disaster medicine. And we were actually going to conduct some research related to what is taught in universities in relation to not just emergency medicine, but disaster medicine. And as you know, disaster medicine is an evolving discipline. And what you mentioned at the end is very interesting, very important, and we need to see a way of introducing the concept of disaster medicine rather than emergency medicine in health professions education. Doctors, nurses, everybody. If you talk to them, they don't even know about this disaster medical assistant teams and all of these issues. I think they need to know of these issues during their undergraduate education, not later on as CPD. What are your thoughts on that?
Actually, building the knowledge throughout the medical students at the beginning of their journey, actually let them become more robust in their response in the further work, like health professional levels days. Actually, we have our experience with Hajj every year. And we have a huge cooperation from all the healthcare sectors, along with the security sectors, along the environmental sectors. And we all collaborate in one mission to success with this journey. And we have built our curriculums, as we are talking right now with Dr. Hisham Dinar and our team in the disaster medical assessment team, in the way that we are conducting a robust curriculum for this special situation and scenarios, and how we can actually improve our outcome year after year, though. And we're not looking from it right now. We actually built our fellowship program in Riyadh. Alhamdulillah, we have one of the leading disaster medicine and emergency management master degrees in such a country. Actually, I'm one of the supervisors, one of them in King Abdulaziz University Hospital. We see the needs from the students. We actually tailor and form their needs to the future outcomes in disaster medicine, and building the Sudanese disaster medical support teams, I believe, will be the key. And as I mentioned in my talk, it's a consultancy-based training is actually what forms a better, resilient medical educators, inshallah.
Thank you.
Thank you very much. Probably I'll add to that point that Professor Sahel, one of the activities that we do every year prior to Hajj, in preparation to Hajj, that we invited medical students in the Western province to be part of the medical disaster medical assistant team, and they learn by doing. So the exposure to the field of disaster medicine, actually, we see this every year. We see the passion for the undergrads, and we already building more capacity and involving more of the student to join this, because we do believe that introducing disaster medicine into health profession curricula will have it impact in the overall resilience, whether it's in the medical education or even in the health care endeavor. The talk is extremely nice. However, I would like to thank everyone in the stage right now. Thank you, Dr. Raymond. Thank you, Dr. Taha. Thank you, Professor Sahel. Thank you once again for the audience for joining us in this very important session. And now I would like to invite you to join the next session in the other room. We are moving now from resilience to quality. So stay tuned.
Thank you. Thank you all.